In 2021, around 3% of U.S. travelers went overseas for medical or dental care. Worldwide, over 20 million people crossed the border to get cosmetic surgery, help with their reproductive issues, or other procedures that are either unavailable or more expensive at home. Top medical tourism destinations bring in billions of dollars every year, which is why it's heavily promoted and supported by local governments, making healthcare easier to get overseas. The health travel market will only grow. According to different estimates, the compound annual growth rate of medical tourism will be from 11.59% to 12.8%. Let's talk about how and why this is happening. Health tourism is the process of traveling to a different country for medical treatment. People have been doing this for ages. As soon as ancient civilizations learned about the benefits of mineral and thermal springs, they started building complexes to accept health pilgrims. For example, temples to the Greek god Asclepius were important centers for medical advice and healing. In the Middle Ages, prominent hospitals in Islamic cities of Baghdad, Cordoba, and Damascus welcomed people from all over the world and were the most advanced and elaborate institutions of the time, where patients suffering from both physical and mental illnesses could be cared for. Today, almost every nation in the world has advanced healthcare facilities and medical staff to provide adequate care. So why do people still choose to travel? The first reason is lower costs. As recently as in the 20th century, patients from developing countries would go to highly developed countries to access better hospitals and trained professionals that their cities lacked. But now the trend is reversed. Globalization and digitalization equalize the quality of care, but the aging world population surpasses the availability of medical resources. So people from Europe, the United States, and Australia go to Costa Rica, India, Taiwan, Turkey, Brazil, Thailand, Israel, Mexico, and Malaysia to get similarly high levels of treatment for a lower price. On average, American medical tourists can save around 30% on healthcare procedures in Brazil and up to 80% in Malaysia. The second reason is accessibility and comfort that international healthcare often provides. To attract medical tourists, healthcare organizations in Turkey, India, South Korea, and more offer entire medical travel packages that, in addition to the treatment itself, include airfare, accommodations, transportation, health insurance, translation services, and personalized assistance. In 2022, the Indian government launched the Heal in India campaign, allowing patients to simplify their medical journey. On the portal, people can easily find the desired treatment or hospital, submit a request, and get their travel documents ready. This is in contrast with the level of attention patients can receive domestically, especially considering long waiting times.
Waiting on surgery for her hip, Maureen Johnston was told it would be up to 2 years. Wanting to get back to her active lifestyle sooner, the 63-year-old retiree opted to speed things up, spending $14,000 and booking abroad.
A medical travel visa is also a thing. To incentivize health tourists, governments offer simplified visa procedures and extra benefits. In India, a medical visa covers up to 2 blood relatives that can accompany the patient, and it can be obtained online. The third reason is state-of-the-art medical techniques and facilities that can be accessed abroad. Although medical tourists usually pay out of pocket for their treatment, they are often willing to pay for treatment in Canada, the US, and UK for their advanced medical services. Oncology is the most common service international patients seek in the US. The United Kingdom ranks 5th in the Medical Tourism Index for their dominant research in the field. Canada is ranked first, though many Canadians still choose to travel out of the country for medical procedures.
Rush required a total hip replacement. She was told the wait for her surgery in Alberta was 15 months. She found a clinic a world away in Lithuania. The wait time there? Just 2 to 4 weeks. For $16,000, she booked her flights, surgery, and rehabilitation.
Other top medical tourism nations might not be as progressive on the general scale, but the investments in healthcare systems and medical tourism programs make them popular destinations. The governments of Turkey, Hong Kong, India, and Malaysia invest heavily in their healthcare sectors. The support for private hospitals, improvement of medical infrastructure, skilled medical workforce, and advanced technologies make them modern healthcare hubs. Safety and the quality of care is also typically ensured with international accreditation. Joint Commission International, the most coveted accreditation agency that ensures international hospitals meet the U.S. standards, has accredited over 950 hospitals and clinics in 100 countries. The fourth reason is a good reputation in specific fields.
It's the lure of cheaper prices and the fact that Korean plastic surgeons are regarded as among the best in the world.
Wow!
Over the last 15 years, South Korea has become a plastic surgery hotspot. The procedures there are known to be quick, affordable, delivering great results. Around 1 million people traveled to Turkey in 2022 for hair transplants. For this reason, the big Turkish carrier has been dubbed Turkish Airlines over social media. As flying from the country, you could often see many people who've clearly undergone the procedure. Wellness tourism is often considered a part of health tourism. And although we made a clear distinction between the two in our previous video, it's important to mention that traditional well-being practices like Ayurveda in India or acupuncture in China attract tourists who believe in their medicinal properties, even though there's no proof of their effectiveness. It's clear what drives people to become medical tourists, but why has it been growing so rapidly in the past decade? Well, the answer is, of course, the greater than ever presence of the internet and social media. Seven in 10 adults research diseases and their treatments online, and almost 30% of people have read or watched someone's health experience on the internet in the past 12 months. Patients find support and community in blogs and special platforms, sharing their treatment experience and also information they've found online. When one person undergoes a successful treatment overseas, others quickly learn about it and explore it as one of their options. Due to distance, clinics also use the internet as the only way to reach international patients. Besides third-party facilitators, similar to travel agencies help patients organize medical trips. They not only assist in arranging the consultation and booking the procedure, but also finding accommodations, organizing transfers, and providing a personal coordinator to respond to all their needs. Medical tourism generates massive revenues, which unfortunately means that it can also generate fraudulent and unethical practices. Promises of cheap or revolutionary medical procedures can often lure people when they're most vulnerable and are willing to explore all the options. For example, stem cell therapy has been approved by the US FDA only for treatment of certain cancers.
The FDA has only approved a stem cell product for treating certain blood disorders. Beware, unapproved stem cell therapies have led to serious infections, blindness, and death.
Yet some clinics outside the US offer unproven and unregulated stem cell therapy. Not only are those treatments unlikely to help the patient, they may also leave them in financial distress and with a high risk of travel-related complications. Sometimes those complications can be fatal. Since 2019, 22 British citizens have died during their medical trips to Turkey for cheap weight loss surgery. Attractive, all-inclusive packages and affordable prices make people ignore the clinic's legitimacy or certification. All of this, of course, doesn't mean that medical tourism is dangerous by itself. It gives people a chance to improve their health more than they would have had and contributes to the global economy. Thanks to medical tourism, the global healthcare industry has been flourishing. Advanced medical facilities are being opened all over the world, and the increased competition encourages them to offer better care and more advanced medicine. By 2032, the medical tourism market is expected to increase almost 3 times. So we may expect to see a more complex digital infrastructure around it. Apart from facilitators that play the part of medical travel agents, we may see a network of online platforms for independent medical travelers for them to find and book medical services abroad and make all additional arrangements with ease. We recommend you watch other videos from our Travel Work series, where we explore other trending travel topics. See you in the next video.